Welcome to Sketchy. We take all the super complex stuff you need to learn and turn them into memorable visual stories packed full of everything you need to know on test day. Click the link in the corner or description to try for free for 7 days. Now let's get to it.
Welcome to the Thousand Acre Wood, where, with the help of Wheezy the Blue and all of his friends, we will be learning all about cystic fibrosis, which, for simplicity's sake, we will be calling CF. We'll cover everything except management, but don't sweat. We'll cover that in another sketch, so be sure to check that out too. Cystic fibrosis is a complex, inherited genetic condition with multi-system involvement that is life-shortening. It is characterized by abnormally viscous secretions and is represented by all of these sappy tree branches. This is a super important condition to know about because it's the most common lethal inherited disorder in Caucasians and is represented by this sign warning of killer Caucasoid bees. The multi-organ dysfunction associated with CF ultimately all stems from an abnormal chloride channel that results in unusually viscous secretions and is represented here by these cracked chloride pots that are leaking salt. A simple way of thinking about this is if there's a tube somewhere in the body, you can count on these viscous secretions to clog it up. This abnormal channel is the result of mutations in the aptly named cystic fibrosis transmembrane conductance regulator gene, which we will call the CFTR gene because 16 syllables is way too many, and is represented by the torn CFTR Robin shirt our human protagonist is wearing. While there are thousands of unique disease-causing variants in the CFTR gene, there's really only one that you need to know about, the Delta F508 variant. If you take a look at this triangular or delta-shaped silly old bear sign, you can see this represented by the S, O, and B, which have been replaced with the numbers 5, 0, and 8, respectively. This 3-base pair deletion is, by far, the most common cause of CF. Now, before we move on, you should know that going forward, each organ system will be represented by one of our eccentric forest friends and their immediate surroundings. For example, the progressive pulmonary disease, which is the primary characterizing feature of CF, will be represented by our friend Wheezy the Blue and his surroundings. This can include chronic obstruction of the airways, which is represented by this obstructed sign on the rope ladder, as well as recurrent pulmonary infections and bronchiectasis, which we'll cover a little later. Pancreatic disease, which manifests as exocrine pancreatic insufficiency and is seen in the vast majority of patients, will be represented by our rabid friend, who happens to be eating a pancreas-like carrot. Hepatobiliary disease, which most commonly presents as gallstones and focal biliary cirrhosis, will be depicted by Billy, our morose billy goat friend with a liver-shaped spot on his belly. Gastrointestinal disease, which commonly manifests as an intestinal obstruction, will be depicted by our energetic jaguar friend, Jagger. That's J-A-G-G-R, that spells Jagger, who is bouncing on his intestine-shaped tail. Last but not least, bone disease will be represented by our faithful dog friend with a bone in his mouth. You should know that this bone disease is the result of a combination of factors, including, but not limited to, malnutrition, fat malabsorption, and hepatobiliary disease. Oh, before I forget, there's also a CFTR-related disorder that can affect some carriers of a CFTR mutation. What sets this apart is that they have one affected organ system and do not meet the clinical or genetic criteria for a CF diagnosis. Since this is kind of like a milder version of CF, this is represented by the look-alike CFTR doll that CFTR Robin is holding. Now, back to cystic fibrosis. CF is much more commonly seen among Caucasians than other populations, and is typically diagnosed within the first 2 years of life, which is represented by this number 2 carved into the tree. In fact, CF is included on all state newborn screening programs, meaning a majority of kids are diagnosed shortly after birth and pre-symptomatically. If you take a look at our wallaby friends, you'll see that Walla has a pouch holding her joey, B. That looks like a torn screen to help you remember this.